Hi, everyone. Good evening. My name is Dr. Letitia, and I am the founder and executive director of Great Joy Counseling and Consulting Services. Welcome to my brand new web show, Coffee and Conversations. I am so excited about tonight's show. Here you will speak to industry leaders, mental health experts about how they are handling the issues that affect us most. My first guest this evening is a dynamic leader, someone that is very dear to me. We had the opportunity to work together, so we'll talk a little bit about that and all the exciting work she is doing. Let me welcome Dr. Laura Rothschild.
Hello.
Hi, Laura. How are you?
Good to see you.
So good to see you. I'm so excited to have you on the show tonight. Thank you so much for being our guest.
Of course. Thank you for having me.
No problem. So I wanted to say a few things about you, and then I want you to introduce yourself because your bio is miles long. You have done it all. So let me read a few things about who you are. What I was saying before you entered the segment, Laura, is that you and I go way back. We both worked together at Rutgers State University of New Jersey at the Center for Alcohol Studies, but we'll talk a little bit more about that. So Dr. Laura Rothschild, PsyD, is an entrepreneurial and dynamic leader with over 2 decades of experience supporting organizations and promoting the health and well-being of youth and families. Trained as a community and school psychologist, Laura has entered her professional experiences on creating innovative strategies that are effective, safe, supportive, and equitable for all. Currently, Laura is a partner and managing director at Mopo Management, where she leads the team in ensuring impact through philanthropic and impact investment strategies. She also has a robust independent consulting practice. So Laura, tell us a little bit about who you are and all the dynamic work that you've been doing in the community.
Sure. So I am trained as a school and community psychologist, and that meant a lot of things that, when I went to school, I wasn't exactly sure. I knew that I wanted to have an impact. I knew that there were ways that we weren't supporting young people and their families in the right way and communities. I wasn't really sure how that would show up or what it would look like. And so I started, as you know, sort of more doing project work. I started my career actually in educational reform work. So I left when I graduated from graduate school. I went and worked in educational reform for a number of years, building large kind of systemic changes all over the country, mostly in urban centers. And that brought me to Rutgers. I actually was working on a project with the folks at the Center of Alcohol Studies at the Center for Supportive Schools where I was. And an opportunity came to really think about how are we doing adult learning and training as it relates to addiction education. And I, for a long time, have been thinking about how are we transforming the folks who are doing the work, right? What does it look like to really train people appropriately? What does it look like for families, for parents, for, those kinds of the grown-ups in young people's lives or in people who are suffering's lives to their support systems to have the right kinds of services. And so that brought me to the Center of Alcohol Studies, where we had the opportunity to work together, which was wonderful. And when I left there, I really had an eye to thinking about how do we build systems differently in the community? And so have spent a lot of times doing that in terms of consulting and really thinking about what does it look like to build behavioral healthcare systems that are effective and viable and really put clients centered. And in that work, it led me to where I am now, which is a private family office that is really interested in moving the needle and thinking about how do we transform communities. And so as part of that work, they were putting together a team who would think about how are we spending money to transform communities? What are we investing in? How are we giving our donations? What does it look like so that we're not, being wasteful, but we're really being generous, and we're putting money into entrepreneurs and folks like yourself who are doing the work in ways that are innovative and thoughtful and different. And so that's where I am now, which is really fun. It's fun to get to give out the money for once instead of being the one sort of searching for it. But it's been a fun ride, and I, still have my foot in both educational reform and straight behavioral health care with my consulting business. So.
That's awesome. And I want to definitely talk about behavioral health and mental health. And why do you think in your work it has been important to you to work with disenfranchised communities and bring, as you mentioned earlier, education to communities that otherwise would not have access to some of these services?
Yeah, I think it's a lot of reasons. One, I think we pathologize too much in behavioral health care. Like, I think we think people are sick, and they're not sick. They, have many of the resources they need, many times to, internally, the resources they need to be able to be healthier and to be more stable. And particularly in disenfranchised and underserved communities, I don't think we do a lot of talking about that, right? So folks are either well and they don't have any support, or they're sick and we're like institutionalizing them. And there's a gray, right?
There's a little gray.
And so, I feel like my career has been in the gray. Like, what does the gray look like? How do we make sure we're being effective? And how do we make sure people get exactly what they need with the least amount of pathologizing, with the least amount of saying people are sick in ways that are going to have long-term ramifications in terms of both diagnosis and, their treatment paths, their courses to treatment.
Do you think, Laura, that is why there is such a stigma associated with communities, specifically disenfranchised communities of color, to access mental health services, right? Because they sometimes may feel that the practitioners don't really understand their walk of life, right? And are quick, right? The research says this, right? That African Americans are, so much more likely to be diagnosed with chronic and persistent mental health diagnoses. So do you think that this is what sometimes keeps people away from accessing mental health care?
Listen, I don't think it gets them walking through the door. That is for sure, right?
Absolutely.
So, folks who look like me, they go to therapy when they stub their toe and it's annoying to them 4 days later, right? Like they, have these existential crises and they sit in the therapist's office and they complain about them. And that is, and has been for a long time, a pretty mainstream practice. But nobody is also diagnosing me with anything that has shame, stigma, or long-term effects to it, right?
Mm-hmm.
And we're not helping ourselves, like whether it's about access and there just not being a way for there to be a level of care that's really on wellness and mental health in some communities, because some of it is access, but also when it's there, people are used to walking into those offices and being labeled in ways that are lifelong, feel very traumatic, and are being part of a mental health system that has really not been focused on wellness, that has been focused on, minimizing sickness maybe, but not even totally that.
What would you say, Laura, mental health means to you? How would you define it? I find it like such a broad topic. So how would you define mental health and wellness?
So that's a great question. I think mental health and wellness for me is, in sort of lay, simple terms, it's that life has lots of challenges. And that when you're sort of facing day-to-day challenges, we're not talking about, things that may be grief-oriented, things that we could use a lot of coping skills, like that we could use supports to get through. I'm talking about, just sort of your day-to-day functioning, that, mental health is the ability to get up in the morning. It's the ability to say, I have control over this situation. I can do this. Or if I don't have control, I know why I don't have control. It doesn't feel, and sometimes we don't have control, right? There are systems of racism and oppression and we don't have control, but we can name them. We see them, we understand how they're affecting us, and we are able to go through our days in ways that feel good. And at the end of the day, we're feeling, fulfilled is a hard word, but that we're feeling connected still to the lives that we're living.
I like the word that you use. You use connection, because I feel like so many people in the last 6 to 8 months have been disconnected, right? And we all know why. We are dealing with a global health crisis, a pandemic that has absolutely changed our very lives. Yeah, like I realized, Laura, that I had Zoom fatigue. Like if I was being traumatized by seeing the emails with the Zoom meeting ID and the login password, like I just couldn't handle it anymore. I guess my question is two-part for you. How did you and how do you manage COVID, right? How do you take care of your own mental health managing COVID? And how do you think people are really doing? How do you think folks are really handling a global pandemic?
So I try to stay connected. I stay connected to family. I stay connected to friends. I try to exercise, to do the things that I know kind of keep me complete. And I'll say the real issue, I think, about people coping is that we're in a global pandemic, something we've never been in before. And it's trauma. It's a universal trauma that we haven't experienced as a culture. It's one we haven't experienced as communities before. And trauma is additive. That's what we know. We know that the more experiences you have with trauma, the more challenging it will be in the long term for your mental health and for your physical health too, actually. And that's because of the way the body responds to trauma. It's a physiological response. And so, I think people aren't doing so great, because the reality is, particularly in some of these communities that we're talking about, is there's already been a lot of trauma. And then we're piling on what is a global pandemic with what seems like no end. And so I think one of the things we can be doing is saying, like, hey, the trauma's real. The things you're feeling are real. It's okay to feel these things. You're expected to feel these things. And you can do things that you won't feel them forever. And so the first is just to acknowledge it. It's okay. It's hard, it's challenging. And the second is to think about, how can we have positive experiences? The piece, what we know about trauma is that it doesn't go away. You can't get it out of your system. But what you can do is have positive experiences that can help to offset the long-term consequences. And so how do we make sure that people are doing self-care in ways that are actually reasonable? We talk about self-care all the time, but often we talk about it in ways that are just it's not going to happen.
Thank you all so much for tuning in to this episode of Coffee and Conversations. I hope that you got some amazing tips about safeguarding your mental health. Thank you so much, and I look forward to seeing you next time. Bye.